calls for the COVID-19 booster shots to be made available for frontline healthcare workers in South Africa. This as the supply of vaccines is no longer in peril, and concerns of new variants as the country braces for the fourth wave of infections. Here to talk to us about this, Dr. Angelique Kutzer, chairperson of the South African Medical Association. Dr. Angelique, good to have you with us once again tonight here on In Focus. With only 11 million South Africans fully vaccinated, maybe at least 15 million who have received somewhat of their first jab, is it not too soon to be calling for a third booster shot?
Good evening, and a good evening to all your viewers out there. I think we need to understand that the Sesonke rollout for healthcare workers started on the 17th of February 2021, and that was a single dose of Johnson & Johnson. So what we then noticed during the third wave is that a lot of our healthcare workers got COVID-19. Most of them were mild diseases, but there was one or two that developed severe disease, and that raised the question whether the immunity is still good on the Johnson & Johnson vaccine on a single dose. And we brought this up with Prof. Glenda Gray, the National Department of Health, and it looks like, if we look at the stats, that 94% of healthcare workers who experienced breakthrough infections following the vaccination as part of the Sesonke rollout program, as I said, started with mild to moderate symptoms, and the vaccine effectiveness was about 65% in reducing hospitalization, which was lower than seen with the Pfizer dosage. So although there is currently not strong evidence from clinical trials that the efficacy of effectiveness of Johnson & Johnson vaccine against severe disease, hospitalization and death is waning over time, we know that this will change, as we have started to see during the third wave.
What are we seeing as a degree of waning? I mean, studies, of course, on the waning of immunity are still pretty much out, but some done in the U.S. are showing, for example, that the defensive antibodies, they halve every 108 days, which means that those vaccines, which were initially 90% effective, would now probably be 70% effective after 6 or 7 months.
Yeah, that's correct. So the results, that a nice study that was just recently released on the Johnson & Johnson showed that the neutralizing antibodies that remained largely stable for approximately between 8 to 9 months, and then your binding antibodies that remain stable for at least 6 months, irrespective of age group. So if you do a booster at 6 months post-prime vaccination, then there was a 9-fold increase at day 7 post-boost compared to day 29 following the initial immunization. So it is important that we get a rapid and high increase in our antibodies, seeing that the time frame has been passed. So the data, again, on Johnson & Johnson seems to be about 56 days after your first vaccine. You need to get a booster. In South Africa, we are going to look at, as we have now said, starting to look at 6 months to 8 months to get that booster for the healthcare workers. Also, we have seen that there's quite a lot of data on mixing your boosters, and the studies done show that there's quite a good immune response as well. If you mix your Johnson & Johnson with Pfizer. But again, for this, Pfizer needs to apply to SAHPRA to run a parallel study on doctors or healthcare workers receive Johnson & Johnson as their first dosage, compare the studies with Johnson & Johnson second dose versus Pfizer. But so far, Pfizer has not yet applied for that. And it's important. I hope that Pfizer listens out there and report and apply to SAPRA so that we can run it, as a lot of doctors and healthcare workers also would feel more comfortable with the studies with mixing if they can get a Pfizer vaccine as their second shot.
How can immune memory be improved without actually getting a third shot and a fourth shot, and we just keep going at that scale?
That's very, very difficult because those studies, showed that, or the study showed that your primary immunity, your immunity that you got from having what we call it natural immunity from being infected before with the COVID virus, or that also starting to wane down. The declining starts about 6 months afterwards with a 5% decline per month. Also around about 18 months, that less than 50% of your immune response is still at this, you would be less than have a 50% less immune response. So that's very difficult. There is not really something that you can do except what we keep on saying to people, wear your mask, hand washing, social distancing. We saw now that even in England, some of the doctors are now calling again for stricter restrictions to be implemented, especially around social distancing, masks wearing. That's about the best that you can do. Yeah. And try to get the children vaccinated. So, we know that they are asymptomatic spreaders.
What about the ethical debate? What are the doctors saying? What's the conversation amongst the doctors to say, well, we still have the elderly over 65s in this country who have not even received their first shot. Instead of talking about a third jab, we should be focusing our energies on how we get those vulnerable people vaccinated.
That's a very good point. And so what the doctors are saying is this should run parallel to each other. The one should not be taking precedence over the 50s, 60-year-olds that still needs to get vaccinated. But you need to understand that if there's a fourth wave, and your healthcare workers, which we know that the immune system is waning down, if they are not getting a second shot, for whether it's Johnson & Johnson or Pfizer, and they get sick, who's going to look after these people who didn't get vaccinated, or the few that did get and still end up with severe disease in hospital? For a doctor or a nurse to get sick, it's 10 days off work. And then everyone else needs to double shift for them. So it is important that we protect them because they're very vulnerable. And currently the mood of the doctors are not the best. They've been through 3 waves. Studies showed that PTSD and the doctors, studies recently done in South Africa, that between 35 and 49% of doctors are suffering from PTSD. Now, you can imagine to go into a fourth wave, you have not been vaccinated, you need to get your booster shot. It's not that. So again, who's going to look after the patients?
Yeah. What are the indications as far as assistance of a third jab with vaccine-resistant variants?
So it will depend on the type of variant. What we know for now, even the variant, the Delta virus, is again mutating according to studies that we saw from England. But again, your Pfizer as well as your Johnson & Johnson at this stage still seem to be effective. But only time will tell us because we don't know how the viruses will mutate going forward. And hopefully our immune system would be able to pick it up and fight them. But only time will tell us.
And of course, we can't be having this debate and this conversation outside of the question of vaccine equity and vaccine availability. You seem to have a sense that we have enough in South Africa at this point?
Yeah. Yes, we have more than enough. We actually need to start moving the Pfizer vaccines quicker, as some of them are nearing their expiry date. So, and Johnson & Johnson, the healthcare workers, it will be under this SOMCare again. And National Department of Health, as well as Prof. Glenda Gray, are working very hard in the background to get at least the Johnson & Johnson vaccines available as a second booster or second dose for healthcare workers. Remember, 6 months from when it was open for public, most likely those 60-plussers who had been vaccinated with Johnson & Johnson will also need to then to go for their second booster shot.
Dr. Angelique Kutza, appreciate your time. Thank you very much for joining us, Chairperson of the South African Medical Association.